Hey, Colin here, and welcome to the Christmas Eve Throwback Thursday episode. Now, for today's Patient Attraction podcast, I want to talk about wish list. And no, I don't mean your Christmas wish list, but I want to talk about the wish list that your patients have when it comes to choosing a new dentist. Now, in this throwback podcast from April of 2014, I talk about how making your 3 patients' wishes come true will yield you more and better patients. Find out what they're trying to find and how fulfilling their dreams will keep your patients coming, paying, staying, and referring. And then join me tomorrow for a special Christmas episode. Hi, Colin, receiver here. Today is Wednesday, April 2nd. And if yesterday was April Fool's Day, today is April Experts Day. And I'm going to remind you of what it takes to attract paying patients that'll pay, stay, and refer when we come back. Happy April 2nd, everyone. I'm Colin, receiver. And not to talk too much about myself, but I've spent my entire life based around dentistry. Whether it was hanging out in Dad's office after school or working there later in life, or working with clients for the past 15 years in the Midwest or around the United States and now around the world. There are 3 consistent messages that get people to buy elective case dentistry: confidence, rescue from pain and discomfort, and return to normalcy. Now, I want to talk first, going through those. First, let's talk about confidence. What does confidence really mean to a patient? Well, it means not having to worry about your denture popping out on a date, or not having to take your denture out to eat food in public, or not being embarrassed to smile at a loved one's wedding because of your missing or discolored or misshapen teeth. Now, this doesn't always apply just to large case dentistry. These are going to be the same emotions that trigger any kind of cosmetic or elective case or orthodontics. These are going to be the emotions that get people to buy any kind of dentistry that makes them feel better about themselves. It might be something as simple as replacing that silver filling with a white one, or replacing that old crown with a new one that's more uniform and matches their teeth, all the way up to full mouth restorations. The second emotion that's going to sell more dentistry is being able to rescue your patients from pain and discomfort and just bad partials or dentures or uncomfortable dentistry that they've had done in the past. And they might have their teeth or their gums are in bad health. They might have dentures that don't fit well or are uncomfortable, or they've got the the goopy adhesives in there that just are horrible. Poorly done implants that they're not happy with, or they don't have confidence that they can chew on. Mini implants maybe, or maybe they have headache and jaw pain. Maybe these are patients that had some work done, and now ever since, for the past decade or more, they've had pain in their jaw and headaches, and they've been to a bunch of specialists and they've never been able to get it fixed. The third item is a return to normalcy. And this is, if the first 2 were the fear of pain, this is kind of dangling the carrot out in front of them. This is eating the foods they love again. This is getting a good night's sleep. This is not having to use dentures and feeling like they have real, permanent, actual teeth. And, there are reasons. There are lots of patients out there that will gladly pay $10,000, $20,000, $50,000 to fix these problems. Of course, depending on where they're at in life, depending on their individual situation. But too many dentists focus on what they do, and they forget why they do it and what they're doing it for. If you focus on what you do, implants and great porcelain and these items, you're only going to attract patients that want to compare specs. Patients that are looking at, okay, this dentist does implants and this dentist does implants, this and this, this and this, this and this. The cheaper price is always going to win because they're just price shopping. They're just comparing specifications. But when you can elevate yourself above that and tell patients about the emotions that you're going to give them back, the feelings that you're going to give them back. You're going to open up their upper palate so they can taste and have temperature feeling and all these emotional things. Emotion is what sells all dentistry. People do business with people they like, whether it's coming in for a cleaning or a full mouth restoration. This is where you've got to be focusing your marketing at. To keep following these podcasts and to get a copy of my new book, check out moreandbetterpatients.com. And you can also subscribe to our monthly printed newsletter that we'll send right to your mailbox. Keep moving forward.